Jamia MPT Master of Physiotherapy Question Paper 2020. Answer key is available on their official website. Question 1. Which among the following is discrete task? Question 2. Physical activity recommendation for older adults. Question 3. Hold relax with agonist contraction is a PNF technique used to. Question 4. The appropriate grade of oscillatory mobilization when the patient present with pain is. Question 5. The glide used to increase protraction at sternoclavicular joint. Please check out the answer key at their official website. Question number 6. Percentage of body weight as initial exercise load for universal leg curl. Question 7. During maximum effort, eccentric contraction, as the velocity of active muscle lengthening increases. Question 8. During a balance training session, the patient is asked to reach in different directions to touch or grasp objects. Question 9. The contraindication for hydrotherapies. Question 10. The patient position and movement to be performed to test grade 3 for tibialis posterior muscle. Question number 11. The mechanism of causing pain that does not fit a typical anatomical or neurological distribution. It is usually initiated by nociceptive stimulus but can continue with no or only minimal ongoing peripheral stimulus. Question number 12. The formula for rate of heat transfer between two materials. Question 13. Method of heat transfer in ultrasound therapy. 14. The technique of combining the use of cold and exercises is called. 15. The application of short wave therapy modulates pain by modifying. 16. The active electrodes should not be placed directly over the bony prominence during electrical stimulation. Question 17. The appropriate choice of electrical stimulation to increase muscle strength post total knee replacement. Question 18. The parameter for edema control using electrical current is. Question 19. The up training using biofeedback. Question 20. Which among is suitable for using in laser while treating deep-seated structures? 21. The direction of line in a shear force is. Question 22. The network forming collagen type 10 or X is commonly found in. 23. In hydrodynamics joint lubrication, the factors that keep the joint surfaces apart are. Question 24. In upper cervical segments, lateral and flexion and rotation are coupled motion. 25. The muscle action during mandibular depression is. 26. The increased humeral retroversion can result. 27. The angulation in frontal plane at elbow joint is caused by configuration of which articulating surface? 28. The common feature which can be present in unilateral gluteus medius weakness as well as in antalgic gait. 29. In weight-bearing exercises, the quadriceps must generate more torque. 30. The largest contribution of ankle muscles to work of walking. 31. The pain may be provoked in symphysis pubis dysfunction associated with pregnancy. 32. The appropriate method of carrying a baby by a mother to avoid back pain problems to the mother is 33. The symptom of hyperventilation during labor in women can be reversed by the technique. 34. The sub-center as a part of National Leprosy Eradication Program is assigned with the task. 35. Kangaroo mother care for low birth weight babies was introduced in which country in 1979? 36. The correct sequence of management of a sudden onset of disaster. 37. As a part of testing of hand function, the patient is asked to make test. It was observed that distal phalanx of one finger doesn't flex. 38. The unfavorable factor for positive outcome in patient with non-operative care for lumbar disc herniation. 39. The muscle commonly becomes short due to sway back posture. 40. The capsular pattern of restriction of hip joint motions is. 41. The bony landmark and sites of measurement for measuring the residual limb length for a through knee amputation is. 42. A patient with rheumatoid arthritis is able to perform usual self-care activities but limited in vocational and evocational activities. The level of functional status according to the American College of Rheumatology revised criteria for classification of functional status in rheumatoid arthritis is. Question 43. Blow on the back of head of trunk will result in. 44. The characteristic feature of chronic pain is. 45. Proximal muscle weakness and tenderness is associated with. 46. A patient after removal of above knee plaster cast for fracture treatment of shaft of femur has difficulty in getting up from the chair. The particular problem falls in which category as per International Classification of Function, Disability and Health? 47. The finding of auscultation of chest in patient with emphysema is. 48. The onset of dyspnea with change in position from supine to sitting. 49. The relationship between pH and PCO2 in blood. Question 50. The change in T wave in ECG due to myocardial infarction is. 51. When doing a mediate percussion to access the density of the underlying organ. 52. The therapist want to engage a patient with cardiological dysfunction to do physical activity at 3 METs. 53. In autogenic drainage technique to remove secretion from lungs. 54. The inhibition of diaphragm is used to correct. 55. The preferred position to reduce work of breathing in patient with known cardiopulmonary pathology is. 56. The heart rate values used to calculate heart rate reserve is. 57. In ipsilateral pushing after stroke, the patient will have problem in weight bearing. 58. Rombuck test is used to check the integrity of which structure. 59. The training suitable to reduce the likelihood of fatigue while doing exercise in multiple sclerosis patient. 60. The strategy to improve motor learning in Parkinson's diseases. 61. Egocentricity is seen in which state of Ranko Los Amigos? RLA level of cognitive function following head injury. 62. Type of lesion in spinal cord which necessitates to assess the zone of partial preservation. 63. The lack of awareness or denial of parietic, parietic extremity belonging to the individual is. 64. A patient report with benign paroxysmal vertigo, which is positional test used to detect which semicircular canal is affected. 65. The stimulus used to check asymmetric tonic neck reflex in a child of 3 months is. 66. Partial weight bearing gait with crutches is modification of what type of gait? 67. The amount of glucose required for athlete during vigorous exercises. 68. The technique used by athletes during competition to achieve relaxation and thus improve performance. 69. The reason for late failure of rehabilitation program for an athlete with knee injury is. 70. A footballer present with hamstring strain. The most common cause for such an injury is. 71. The clock exercises is targeted to improve which of the muscle in upper limb in fact in fast bowler. 72. The method for testing extensor endurance in athlete is. 73. A long distance runner is undergoing training and he is asked to perform grapevine step. 74. The cupula of vestibular apparatus in resting position. 75. The memory loss commonly associated with lesion at hippocampus. 76. The process in which antibodies cover the toxic sites of antigenic agents is. 77. The reason for action potential termination is. 78. The pressure in the ventricles during period of isovolumic contraction in a cardiac cycle is. The pressure which opposes filtration in kidney is. Question 80. The location of zone 3 pulmonary blood flow is. 81. The continuous discharge neurons are commonly present in. 82. The type of epithelium found in lining of blood vessels is. 83. The repeated structural units in compact bone is. 84. The number of foramina in present in sacrum is. 85. The structure which separates individual muscle fiber is. 86. The muscle that divides the neck into two major triangles is. 87. Which is the only spinal nerve that does not have corresponding dermatome? 88. What percentage of diencephalon is constituted by thalamus? 89. Inferior vena cava pierces the diaphragm at what level? 90. The name of additional fissure in right lung is. 91. Classification of monosaccharides is based on number of which elements? 92. The supernatant obtained when plain blood is allowed to clot is. 93. The feature not associated with endotoxin is 94. Vidal test is used to diagnose the disease. 95. The cell from which bronchial carcinoid arise is 96. There will not be alteration in glucose content of CSF in which condition. 97. The most basic level of measurement is 98. Chi-square test is used to analyze. 99. The non the non-proprietary name of acetyl acetic acid is acetyl salicylic acid is 100. The drug used in treatment of diabetes mellitus is. Thank you.